In 1989, the hyperbaric medicine world exploded for me. Out of nowhere came a series of cases that I never could have imagined I'd be treating. I remember one in particular that really opened this whole world for me. And it was a 33-year-old guy who was heavily intoxicated, driving along in his pickup truck, lost control, and hit a pine tree. And a high-speed accident. The impact was so great that the headlights had curved around, not quite touching the other side of the pine tree. And of course, big intrusion. And he was immediately paralyzed and on the floor of the cab of the truck. And the acute injury had damaged his spinal cord. The paramedics told me what had happened. They brought him in. And by the time he got to the emergency room, he had a little flicker of movement in his left great toe and a little bit of sensation around it. And of course, it did all the emergency stuff, checked him for other things, and then sent him to X-ray and CT and did all the imaging. And by the time another hour had passed, he lost that little bit of movement of his left great toe and was totally paralyzed. He had absolutely no feeling. Pinprick pain, didn't matter, couldn't feel it. And of course, the x-rays came back negative, couldn't see a fracture. I called the neurosurgeon and decided that even on CT scan, we hadn't seen it. So the neurosurgeon decided he was going to do a myelogram, which was inject dye into the spinal column, and then they tilt them on a table, move them around to try to see if the spinal cord has been disrupted. And no findings. All of this took about 6 hours or more. And finally, we're at 2 a.m, and the radiologist who'd been called in, the neurosurgeon, who of course was there, myself, we're all standing in the radiology reading room looking at all of the light boxes and the images, and we couldn't find anything wrong. There was no fracture, there was no cord disruption, nothing. He either had a stretch injury to the cord or a vascular injury, or in the process of the stretch from the acute flexion and bending, he had interrupted the blood supply. Temporarily or permanently. Blood vessel in spasm or a ruptured blood vessel, don't know. But you couldn't, at that time we didn't have MRI and we couldn't see the pathology in the cord. And we all just looked at each other and thought, what do we have to offer? And so we're looking at each other and we just got to thinking, what else do we have to offer? What can we do? And of course we had the hyperbaric unit in at that hospital for about 3 years. The obvious conclusion was, this guy's spinal cord needed oxygen. And they asked me, what do you think? I said, absolutely. It's been used in all sorts of acute injury situations. It ought to have some effect. Talked to the patient, consented him, put him in the hyperbaric chamber. We got him in the chamber at depth, pure oxygen, under pressure. And next thing you know, he started wiggling that toe that he had a little movement in before, but it disappeared and was now paralyzed. And of course, we were excited. We knew we could reach the injury at depth with oxygen and pressure. We took him out of the chamber and he actually had a little sensation in that same area. Every day we brought him down and treated him in the chamber a couple times a day. And by the 17th day, he got up and actually ran out of the hospital. He was under arrest, and of course they've been waiting to take him to jail until he was medically cleared. But by that time, he recovered almost all the function, and enough so that he was able to get up and not only walk, he ran out of the hospital. And I don't know what happened in follow-up, where he is and how well he's doing, but it was so amazing, and it just underscored the power of what this therapy could do. Complete paralysis, and within days, restored. And actually the inkling of it immediately, the first treatment in the chamber, really launched my life and career professionally. Because seeing what this could do in this situation, my imagination ran wild. The possibilities were absolutely endless in medicine.